Stop. Do not drink anything before bed tonight until you hear this. Because one common nighttime habit is quietly raising blood pressure in seniors, and most people are doing it without even realizing the danger they are putting themselves in. It is a silent, invisible threat that waits for the lights to go out. The worst part is that it happens while you are asleep. Most people never notice it until it is too late, and they wake up wondering why they feel exhausted, or why their morning readings are off the charts. You see, your blood pressure is supposed to drop at night. It is a natural biological process called dipping, where your cardiovascular system finally gets a chance to rest and recover from the day's stress. But for many people, especially those over 60, that dip never happens. Instead of resting, their heart is working overtime in the dark. This is the phenomenon of the non-dipper, and it is one of the most dangerous predictors of future health crises. And if your morning readings are consistently high, you may already be one of them. Here is what the research shows. More than 50% of adults over 65 are non-dippers. That means more than half of everyone watching this video right now may have blood pressure that stays elevated or even rises during the night. And non-dippers carry cardiovascular mortality risk 3 times higher than people with identical daytime readings. 3 times higher risk, with the same medication, the same diet, just from what happens during those 8 hours of sleep. My name is Dr. Favor Adeyemi. I have spent over 10 years helping patients over 60 understand and manage their cardiovascular health. And today, I am going to show you the drinks that research shows can genuinely support healthy overnight blood pressure, and the drinks you must stop taking before bed immediately. Stay with me because the last drink on this list is one most people would never expect, and the science behind it is remarkable. Before we talk about what to drink, I need you to understand what is happening in your body at night, because if you skip this, the drinks will feel like random tips. With this foundation, they will make perfect scientific sense. When you fall asleep, your brain sends a signal to your autonomic nervous system to shift into a lower gear. Your heart rate slows, your kidneys process waste efficiently, your blood vessels relax. This is the dipping window, and it lasts from roughly 11 p.m. to about 3 a.m. During this window, your cardiovascular system does its most important repair work of the entire day. But 3 things can destroy this window completely. First, high sodium intake in the evening. Salt causes your kidneys to retain fluid. More fluid in the bloodstream means more pressure against the vessel walls. This effect is especially strong overnight when your kidneys are supposed to be processing and releasing fluid naturally. Second, dehydration. When your blood becomes thicker from not drinking enough during the day, your heart must work harder to push it through your vessels. Blood viscosity, which is the thickness of your blood, rises overnight. A thicker blood in stiffer vessels at night is a dangerous combination. Third, stimulant drinks taken within 2 hours of bed. Caffeine, alcohol, and even certain herbal teas that contain cortisol-spiking compounds can activate your sympathetic nervous system right when your body is trying to calm it down. The result is that your blood pressure never gets the chance to dip. Now let me tell you about a patient I will call Bernard. Bernard was 69 years old, retired civil servant. He was on 2 blood pressure medications. His daytime readings were consistently in the acceptable range. His doctor was pleased, but Bernard was always exhausted in the mornings. He had frequent headaches before breakfast. His thinking felt slow for the first 2 hours of every day. When I put Bernard on a 24-hour ambulatory blood pressure monitor, the night readings told a completely different story from his daytime readings. At 2 a.m., his blood pressure was 162/98. His heart had been working at hypertensive crisis level while he slept peacefully, completely unaware. When we reviewed Bernard's evening habits, the pattern became clear immediately. Every night before bed, he drank a large mug of strong tea with 2 teaspoons of sugar, then a small glass of whiskey to help him relax. Then he went to sleep. 2 common drinks, both quietly working against his cardiovascular system every single night. We will come back to Bernard. because what changed in his overnight readings after he made 3 specific drink adjustments is one of the most striking improvements I have seen from a lifestyle change alone. Now let me give you the drinks that actually work for blood pressure at night, and let me explain exactly why each one works at the physiological level. Drink number 1, warm tart cherry juice. Tart cherry juice is one of the most underestimated cardiovascular drinks available, and the research behind it is genuinely impressive. Tart cherries are one of the richest natural sources of melatonin outside of the brain. Melatonin is the hormone your body produces to initiate the sleep cycle and trigger the nocturnal dip in blood pressure. After 60, melatonin production declines significantly, which is one of the main reasons the nocturnal dipping pattern weakens with age. A study published in the American Journal of Hypertension found that tart cherry juice consumption significantly reduced both systolic and diastolic blood pressure in older adults. The researchers identified 2 mechanisms. First, the melatonin content directly supports the autonomic shift toward the parasympathetic state needed for blood pressure dipping. Second, the anthocyanins in tart cherries inhibit an enzyme called xanthine oxidase, which is a major producer of free radicals that damage arterial walls. A separate study published in the European Journal of Nutrition found that tart cherry juice reduced blood pressure by an average of 7 mmHg systolic and 4 mmHg diastolic in hypertensive older adults over a 4-week period. The protocol is straightforward. Drink 240 milliliters, which is about 1 cup, of unsweetened tart cherry juice 30 to 60 minutes before bed. Not sweetened, not a blend, pure tart cherry juice. The sugar and sweetened versions counteracts the cardiovascular benefit by spiking insulin and increasing fluid retention overnight. Drink number 2, hibiscus tea. Hibiscus tea has some of the strongest clinical evidence of any natural drink for blood pressure management. Multiple controlled trials have confirmed its effect, and the mechanism is well understood. Hibiscus flowers contain compounds called anthocyanins and organic acids, specifically hibiscus acid, that inhibit an enzyme called ACE, which stands for angiotensin-converting enzyme. ACE is the exact enzyme that a major class of blood pressure medications targets. Hibiscus blocks the same pathway naturally, without a prescription. A meta-analysis published in the Journal of Hypertension reviewed 5 randomized controlled trials and found that hibiscus tea produced an average reduction of 7.6 mmHg systolic and 3.5 mmHg diastolic blood pressure. These are clinically meaningful numbers. For context, a standard starting dose of an ACE inhibitor medication reduces blood pressure by roughly 8 to 10 mmHg systolic. Hibiscus comes within range of that through a natural mechanism. Preparation matters enormously for hibiscus tea. Use 8 to 10 grams of dried hibiscus flowers, not a tea bag blended with other herbs. Steep in near boiling water for 10 to 15 minutes. The brew should be deep burgundy red, not pale pink. A pale color means insufficient steeping time and insufficient active compound extraction. Drink 1 cup, unsweetened or with a small amount of raw honey, 60 to 90 minutes before bed. Important caution: if you are already taking blood pressure medications, speak with your doctor before adding hibiscus tea to your routine. The combined effect can be additive, and your doctor may need to review your dosing. If you have made it this far, you are clearly invested. You want to see what happens next. But most viewers enjoy the content and scroll away without subscribing. If this one really means something to you, tap subscribe. It takes a second. If not, you will probably forget this channel exists and miss a lot of great educational content ahead. Over the years in my clinic, I have seen something very simple make a real difference for people over 60. It is not about doing anything extreme. It is about doing the right small things every day. That is why I created a guide called 30-Day Blood Pressure Reset for Seniors. It is a simple, step-by-step plan designed to help support healthy blood pressure through gentle daily routines, light exercises, and clear guidance you can follow at home. Some of my patients have used this same structure and told me they felt more in control of their daily habits and more confident about their readings. I am not opening this to everyone. I am only allowing 30 people to go through it right now because I want to follow up closely and see how each person is doing. If you feel like your current routine is not giving you the clarity you need, you can click the link in the description or scan the QR code on your screen to get your copy before the 30 spots are filled. And because you are part of this community, I have made it easier with a 70% discount so it stays affordable for you. After completing your purchase, please drop your email so I can follow up with you personally. I will check in with you through email and help you stay consistent with the plan. Drink number 3, warm skimmed milk with a pinch of nutmeg. This is the drink that surprises people the most, but the science behind it is solid. Milk contains 3 compounds that work together to support blood pressure at night. The first is calcium. Calcium plays a direct role in regulating how hard the smooth muscle surrounding your blood vessels contracts. Low dietary calcium is consistently associated with higher blood pressure in older adults. A meta-analysis published in the Journal of Human Hypertension found that calcium supplementation reduced systolic blood pressure by an average of 2.55 millimeters in hypertensive patients. The second is tryptophan. Tryptophan is an amino acid that is the precursor to both serotonin and melatonin. Drinking warm milk in the evening provides a gentle tryptophan pulse that supports your body's natural melatonin production cycle and encourages the autonomic shift toward the parasympathetic state needed for nocturnal dipping. The third is potassium. Milk is a meaningful potassium source. Potassium and sodium are direct biochemical opposites in the kidneys. Higher potassium intake signals the kidneys to excrete more sodium, reducing fluid retention and lowering the pressure on vessel walls overnight. The nutmeg addition is specific. Nutmeg contains a compound called trimyristin that has mild sedative properties and supports parasympathetic nervous system activation. Research has shown small amounts of nutmeg can reduce cortisol levels and improve sleep quality, both of which directly support nocturnal blood pressure dipping. The protocol is 1 cup of warm skimmed milk with a tiny pinch of nutmeg, no added sugar, taken 30 to 45 minutes before bed. Use skimmed rather than full-fat milk to avoid the saturated fat that can contribute to arterial stiffness over time. Drink number 4, room temperature water with magnesium. This is the simplest drink on this list and the one most people overlook entirely. Magnesium is one of the most important minerals for blood pressure regulation and one of the most commonly deficient in adults over 60. Research published in the European Journal of Clinical Nutrition found that magnesium deficiency is present in up to 40% of older adults, and magnesium deficiency has a direct measurable effect on blood pressure. Here is why. Magnesium is a natural calcium channel blocker. It regulates the flow of calcium into the smooth muscle cells surrounding blood vessels. When calcium flows into these cells without magnesium to regulate it, the muscle contracts more tightly, the vessels narrow, the pressure rises. Magnesium keeps the vessels relaxed and flexible. This is the same mechanism that pharmaceutical calcium channel blockers use through an entirely natural mineral pathway. A meta-analysis of 34 randomized controlled trials published in the American Journal of Clinical Nutrition found that magnesium supplementation reduced systolic blood pressure by an average of 3 to 4 mmHg and diastolic by 2 to 3 mmHg. In the context of a consistently elevated overnight reading, these reductions are clinically meaningful. The practical instruction is to dissolve a magnesium glycinate supplement, 200 to 400 milligrams, in a glass of room temperature water and drink it 30 minutes before bed. Magnesium glycinate is the most bioavailable form and the gentlest on the digestive system. Ask your doctor about the right dose for your situation, especially if you have kidney disease, because magnesium dosing must be adjusted for reduced kidney function. I promised I would come back to Bernard. After our consultation, Bernard made 3 specific changes to his evening drink routine. He stopped the strong tea after 6 p.m. He moved the whiskey to earlier in the evening and reduced it to once a week. And he replaced his nightly drink with 1 cup of properly brewed hibiscus tea, followed by a glass of warm skimmed milk with nutmeg 30 minutes before bed. 6 weeks later, we repeated the 24-hour blood pressure monitor. His overnight readings had changed dramatically. His 2 a.m. reading, which had previously been 162/98, was now 134/82, still not perfect, but a reduction of 28 mmHg systolic overnight without any change to his medication from 3 drink changes alone. His morning headaches were almost completely gone. His cardiologist, reviewing the monitor results, noted the improvement and described it as the most significant lifestyle-driven overnight blood pressure change he had seen in a patient without medication adjustment. Bernard's question to me at that follow-up was the same question I have heard many times. Doctor, why did nobody ever talk to me about what I was drinking before bed? That is exactly why I made this video. Let me bring this all together simply and clearly. After 60, your blood pressure is supposed to drop at night. More than half of seniors over 65 are non-dippers, meaning that drop never happens. Non-dippers carry 3 times the cardiovascular risk of people with the same daytime readings. The drinks you take before bed can either support that overnight dip or destroy it. The 4 drinks that support overnight blood pressure dipping are unsweetened tart cherry juice for melatonin and anthocyanin support, properly brewed hibiscus tea for natural ACE inhibition, warm skimmed milk with nutmeg for calcium, tryptophan, and parasympathetic activation, and room temperature water with magnesium glycinate for natural calcium channel blocking. The drinks to stop immediately before bed are strong tea or coffee after 6 p.m., alcohol within 2 hours of sleep, and any drink containing hidden stimulants or cortisol-spiking herbal compounds. Here is your action step for tonight. Check what you normally drink in the 2 hours before bed. Replace one of those drinks with hibiscus tea or warm milk with nutmeg. That single change, repeated consistently, is where the improvement begins. Which of these 4 drinks will you try first? Tell me in the comments. I read every single one. And if someone you love is struggling with high blood pressure, share this video with them tonight. The information is here. The drinks are available. What they need is someone to show them the connection. Before you go, I want you to think about something. Most people keep waiting for the perfect moment to take their health seriously, but that moment usually never comes. That is exactly why I put together my guide, 30-Day Blood Pressure Reset for Seniors. It is made to help you follow a simple daily routine that supports healthy blood pressure without confusion or stress. It includes gentle exercises, daily habits, and a clear plan you can stick to day by day. I have seen people in my care feel more confident just by following something structured like this. Right now, I am keeping it very limited to just 30 people because I want to treat it like a small group I can observe closely. Once those spots are filled, I will close it. If you feel ready to start something simple and structured, you can click the link in the description or scan the QR code to get your copy now. And since you are part of this audience, like family to me, I have added a 70% discount so you can get started without worrying about the cost. After completing your purchase, please drop your email so I can follow up with you personally. I will check in with you through email and help you stay consistent with the plan. Disclaimer: everything shared in this video is general medical and nutritional information based on current published research. It is not personal medical advice for your individual situation. Before making changes to your diet, supplement routine, or medication schedule, please speak with your own doctor first. They know your full medical history and can advise you on what is safe and appropriate for your specific health profile. This video is a starting point for that conversation, not a replacement for it.